Pranam to Swami Vivekananda. Let's start today's scientific discussion. And we are really delighted to have with us our first speaker who needs no introduction to this audience. He is a teacher of teachers, professor of professors. So we have with us Padma Shri Shashank R Joshi, sir. So without wasting any time, we all are keen to learn from Professor Shashank Joshi, sir. So over to Joshi, sir.
Am I audible? And are my slides visible?
Yes, sir. It's visible, sir.
First of all, my pranam to Swami Vivekananda. Today we are here for a youth day. I have to thank Professor Shambho Samazdar for constantly trying to indulge, ancient wisdom and modern medicine. And he told me to talk on a subject very close to my heart and close to his heart, which is spirituality and health, the forgotten connection. I don't have any duality or conflict of interest for this talk, except that me and Shambho do publish some work together. So before I go into the subject domain, there is a lot of neurobiology and neuroendocrinology and neuroimaging of spirituality and brain. And one of the classic subjects is brain scans of Buddhist monks who practice meditation in scanner. They showed significant changes in cerebral blood flow during meditation. And during meditation, there was significant increase in activity of frontal lobe, focusing on attention and concentration. And this increase in activity of frontal lobe significantly correlated with decrease in the activity in the left superior parietal lobe, which is involved in orientation in time and place. So, when I'm talking of spirituality and meditation, there is biology and science and evidence base to back it up with documentation. And this is the documentation of the frontal lobe activity of Buddhist monk meditating. And you can see very clearly the increase in the cerebral blood flow. And here you can see that the decrease in the cerebral blood flow during meditation in Buddhist monks meditating. So there is documented evidence, and this is not new evidence. This is evidence almost 22, 23 years old. So spirituality has emerged as a concept in healthcare literature, and the streams of thought about spirituality are different. For example, for theologians, for dogmatists, for philosophers, for traditionalists or folk traditionalists, for social scientists, but we are all clinicians. So clearly, a lot of people mix spirituality with religion. And spirituality in Latin means to breathe. And breathe is something which is the essence of yoga. And religion from Latin means to bind. So if you look at, one is a breathing, other one is to bind, all are connected with a context of piety or concentration. So the two common views of relationship between spirituality to religion are in these two boxes summarized, and therefore there is a spiritual history taking. And this is from the author of FICA assessment, which I will come back to a little later, that I see spirituality which allows a person to experience transcendent meaning of life. It's often expressed as a relationship with God, but it could be also with nature, with art, with music, with family, team, community. Whatever beliefs and values give a person a sense of meaning and purpose in life. Patients learn to cope up and understand their suffering through their spiritual belief or a spiritual dimension in their lives. So this is a construct on which the entire biological basis for inclusion of WHO of spiritual health really came about. So as I told you, the FICA framework is nothing but spiritual history taking, which is faith, importance, community, and address. These are the key components in any spiritual history. And therefore, when we understand this, faith is, do you consider yourself spiritual or religious? Importance is how spiritual beliefs influence your health. Communities, are you a part of a commune or a spiritual community or a religious community? And address is, how do we address your specific spiritual needs? So remember that when you look at role of spirituality in a patient's life, Spiritual history is integral in understanding, and we need to understand this context very clearly. So, when you want to identify spiritual needs to history taking, a spiritual history is a tool to discern. It is the patient's existential and spiritual concerns, example, questioning, faith, search of meaning, coping mechanisms, and inner source of strength when they are aggrieved with pain or cancer or chronic illnesses, openness to faith based interventions like counseling, which often work like CBT, including prayer. Prayer is a form of a cognitive behavioral therapy now, people think. And then the questions which are key to ask is what helps you to go through tough times? What meaning does it have through illness hold for you? And what are your hopes and fears for the future? So this is how we contextualize it. So clearly we now understand that spirituality has emerged as a character in healthcare literature because of inclusivity and diversity. The interest is going beyond the limits of religion. The focus is here and now, individual and human experiences. Focus is a pragmatic view of coping, and it is contextualized with health, and some degree of ambiguity may still exist. So when people try to connect a religion affecting physical health, this model and slide is very common, where religion or spirituality, mental health, social support, and health behavior impact stress hormones, immunology, autonomic nervous system, disease detection and compliance, and high risk behaviors, which eventually lead to either accidents or sexually transmitted diseases or diseases of bowel, gut, liver or lung, stroke, hypertension, heart disease, cancer, diabetes, or infection. I am moving gears because today is Vivekananda Day, and I am going to go through the journey of our ancient scriptures and how our ancient scriptures have really sort of given us a basis for yoga. So when we look at yoga and origins of yoga and the Vedic origins of yoga, it is linking Upanishads to yoga. Yoking first the mind is the idea of yoga, which is a control of the lower mind, such as Yoga Sutras, and the awakening of higher intelligence. So that is how our Rishi Munis were integrating yoga, and they decided to yoga it. In fact, the Sir Arbindo very nicely said that if you need to really ascend the ladder of self-realization, you will need to be going through formulas which are mindfulness and use and tap various episodes of Vedic practices. So we have evolved and integrated into Upanishads and classic yoga. So we have transited from ritualistic Vedic practices to philosophical insights of Upanishads. And from there gave the birth of concepts of self, reality, and liberation. And these are actually best collated by sage Patanjali, who really put out and gave the first encyclopedia of the classic yoga system. Obviously, the sages and our saints passed our entire spiritual practices through word of mouth, and inscriptions were rare, and tapping of the inscriptions and understanding of the inscriptions were further rare. So fundamentally, it was sage Patanjali who compiled Yoga Sutras. His work is a compilation of earlier traditions, connecting them to a system of yogic philosophy. So if you look at Veda Raksham, and if you look at the tree of Veda Raksham, we have the Atharveda, through which the birth of Ayurveda came in, and the Upanishad, through which the yogic philosophy was born. It was based on very simple constructs of the five elements: air, space, fire, water, and earth. And the dosha is the physical constitution, guna is the mental constitution. The dosha is vata, pitta, and kapha, and the guna is rajasa, sattva, and tamasa. And based on the disorders of dosha and guna, physical or mental, disorders evolved. And then solutions came in. And the solutions came in through four ways. First, of course, is Ashtanga Yoga, the practice of 8 limbs of yoga. Then Ahara, yogic diet recommendations. Then Vichara, which is behavior and cognitive modifications as per traditional understanding. And Vihara, which is lifestyle modifications, including sleep and physical activity to harmonize biorhythms. So if you look at the Ashtanga Yoga, Ahara, Vichar, and Vihar. That's a holistic program for mental well-being and overall health and balancing the states of doshas and gunas, which was inscribed by our ancestors. So fundamentally, the Panchakoksha model of correlation of dosha and guna is a layered model, layer by layer. The outermost layer being the physical layer, the Anamaya. Then is the energy layer, which is the Pranamaya. Then is the mind layer, which is Manomaya. Then is the intellectual layer, the Vinamaya. And then there is a layer of bliss, the Anandamaya. In fact, recently I wrote a speaking tree in Times of India on the bliss technology and bliss. So ultimately, we are moving towards Ananda, which is bliss. We have Vinay, Vijay, which is intellect. We have Manomaya, which is mind. We have Pranamaya, which is energy. And we have Anandamaya, which is physical layer. And if you look at the Anandamaya kosha, the dosha, the movement is Vatta, Pitta is metabolism, Kapha is lubrication. If you look at the Manomaya kosha or the gunas, which is the second layer, you can clearly see the third layer, sorry. It is Sattva, which is calmness, Rajasa, which is restlessness, and Tamasa, which is lethargy. And that is how evolution of the entire Panchakoksha model of dosha and guna correlation has occurred. So when we look at the holistic essence of Vedic medicine, and when we look at the introduction of Vedic medicine as an ancient system of healthcare, it is a balance between body, mind, and spirit. And it is not just absence of disease. And therefore, when we are looking at a concept of health, it is exactly what the WHO defines, that it is it is a state of complete physical, mental, emotional, and spiritual well-being. And therefore, the aim of Vedic medicine is to prevent illnesses, promote longevity, and nurture individuals' inherent healing capabilities. And that is something which we need to recognize. And it is best understood by the chariot analogy of the Katha Upanishad. In fact, the Katha Upanishad has this entire chariot analogy, which will give you a beautiful conceptualization of this entire role. And if you look at the chariot, and I'll come back to the previous slide, which is based on the Katha Upanishad. And if you understand this, you will understand a lot. So if you look at Atman, which is consciousness, if you look at higher intellect, which is Buddhi, if you look at mind, which is Manas, and if you look at the senses, which are Indriyas. And then if you come back on the chariot analogy, body is a chariot, senses are the horses, mind are the reins, intellect is a charioteer, passenger is the higher self or Atman. And if you look at the relationship and distinction between physical body or chariot and the higher self or pure consciousness, which is Atman, and if you look at the importance of controlling senses or horses through mind or reins, guided by intellect, the charioteer, to achieve the psychological well-being and spiritual growth. And this was all actually put out by our ancestors and our sages and saints. In fact, we discovered zero, Aryabhatta discovered zero, and the number philosophy is called the Sankhya philosophy. And in that, there are two independent realities, the Purusha or the self and the Prakriti, which is matter. And therefore, achieving the union with self, with the higher consciousness, is the key goal. And this is best illustrated in this Katha Upanishad model of the chariot. Moving gears from there, Yoga also has yoga bioenergetics. And we also know the chakra philosophy. Just like we know the Sankhya philosophy, we know the chakras. And chakras are nothing but activation of the various Kundalini energies. Is there a biological basis for the bioenergetic chakras? If you look at energy balance, which we understand today in the energy kinetics, it is total energy intake, total energy expenditure. And if you look at the Kundalini energy states, the dormant state has limited spiritual understanding, where perceptions are grounded to mundane and selfish views. The aroused Kundalini state has a temporarily spiritual insight and energy lacking stability. The awakened state is a stable state of transformation of consciousness and progressive spiritual realization. So if you look at what a yogi is trying to achieve, it is trying to awaken the Kundalini energy to achieve Kaivalya. Kaivalya is freedom. And from the inner self or Atman to control the body's energy centers or the chakras and senses. So the whole idea is to, if you look at, even I live from the city of Mumbai, one of the top yoga institutes is at Santa Cruz, the other one is at Kaivalya Dham. Kaivalya Dham is nothing but freedom. from Atman so that you can control your body energy centers or the chakras and balance them out. So fundamentally, a focus of a yogi is not just physical strength or athletic abilities, but to control the bodies, to develop Atman through abstinence, yamas, purity, moderation, and modesties, which is niyama, and integrate the lifestyle of diet and physical activity principles based on yamas and niyamas, which are rules and rituals. And if you do this practice systematically, you will have enhanced vitality, improved perception of physical conditioning, social functioning, quality of life, and also sometimes when the yogi is evolving, they have exceptional physical abilities like muscular flexibility, strength, stress control when they practice postures or asanas. So there is science behind all this, and we should not dismiss it. For example, we can understand energy expenditure through yogic practices. We know that there is total energy expenditure, TEE. We know there is resting energy expected, REE. We know there is basal energy expenditure, BEE. And there are metabolic indicators and measurements used to study body's energy balance and control body weight. And the highlighting the gap in research of TE during Kundalini energy activation is something which we are researching in. In fact, we know what is Hatha Yoga. Hatha Yoga is asanas, pranayama, and dhyana. And we can actually measure the physical intensity of Hatha Yoga in terms of VO2 max and metabolic equivalents of METs. And if you look at comparative MET values of Hatha Yoga practices against physical activities like walking, jogging, and cycling, we can have protocols in which there are low intensity common Hatha Yoga protocols which are limited cardiovascular benefits. You can improve physical performance, hemodynamic function with increased cardiorespiratory reserve with Hatha Yoga. And you can also do local muscular adaptation for some physically intense asanas. We can actually do breathing exercise of pranayamas, and psychophysiological control or concentration also can be achieved from the same. So remember, asanas are not just postures. Yes, they are physical postures designed to purify body, to improve health and promote spiritual growth. But if you look at the summary of evidence-based benefits, they improve flexibility, they improve muscle strength and tone, they enhance respiratory and cardiovascular health, they improve athletic performance, and they protect us from injury. So am I talking off my hat, or is there something genuine about yoga? Is it evidence-based or is it a placebo? Well, this is a systematic review and meta-analysis of role of yoga in management of chronic diseases. And you can clearly see the odds ratio here of published literature to show that yoga improves exercise capacity, and yoga clearly has documentary evidence to improve health-related quality of life. So the yoga has an impact on exercise capacity and health-related quality of life in chronic diseases. So can yoga improve, I'm an endocrinologist, improve glycemic control and other health parameters in pre-diabetic states? And this is a systematic review and meta-analysis of the same. That meta-analysis uncovered the improvements in glycemic control, lipid profile, and various populations in the pre-diabetic populations. And this is something which we work on systematically. That was about asanas. What about breathing techniques for vital energy or pranayamas? Well, we know there is focus control in breath, which is vital life energy, and improved respiratory functions, which are clearly documented to improve stress and anxiety. And we clearly recognize that when you do the pranayama, you are activating the slowly adapting stress receptors, generating inhibitory impulses on neural tissue, synchronizing the tissue, decreasing the action potential, and increasing the parasympathetic dominance. The whole idea of yoga, we are living in a sympathetic world. We are hyper and stressed out. We need to increase our parasympathetic tone and dominance. And therefore, through pranayama, you can increase your parasympathetic dominance, decrease the blood pressure, heart rate, and oxygen consumption. And not only that, by doing pranayama, you're stretching the fibroblasts surrounding the lungs. You are generating hyperpolarization current. You are again synchronizing the neural tissue, including hypothalamus and brainstem, and the resting membrane potential polarity in the surrounding tissue, decreasing metabolic activity. So ultimately, pranayama is promoting parasympathetic dominance. The final component, first was asanas, then is pranayamas, and finally is meditation. cultivating inner peace through meditation, which is dhyana. Dhyana is a meditative practice aimed at developing deep concentration and a state of profound peaceful stillness and insight. And summary of evidence worldwide published literature shows that meditation directly impacts mental health, including reduction of stress, anxiety, depression, improvements of attention, memory, and emotional regulation. In fact, this is a systematic review of meditative therapies which improve the sleep quality and fatigue, as well as have antidepressive effects, especially in people who have mental health disorders. And they improve attention, awareness, point of focus, and self transcendence. This is an excellent review. Let me look at fasting. Every religion has fasting. Ramadan fasting will come up in March. Lent fasting will come out in the Catholics. So every religion has fasting. And Jain fasting is Parushan. And in India, in Hindu tradition, we also have the modern fasting. But what has got more popular today is intermittent fasting. Can we align modern intermittent fasting with Indian tradition? You know that intermittent fasting is a health trend. It's a populist trend. Evidence base is not so great. It's cycling between periods of eating and fasting for weight management, metabolic health, and longevity. Remember, traditional Indian practice is to have dinner before sunset to modulate circadian rhythm and have benefits of digestion, sleep quality, and detoxification process. It is connecting the times of meal of circadian biology, highlighting how early dinner practices align with optimal metabolic physical health akin to principles of fasting. So this is a meta-analysis of intermittent fasting compared with non-intervention diet caloric restriction. And you can see intermittent fasting showed less benefit compared to eating less or caloric restriction. And this is the data on the same. Yesterday was day before yesterday or yesterday was Vaikunth Ekadashi, day before yesterday. And Ekadashi is a traditional Indian fasting practice on the 11th day of the lunar cycle. This is again a practice for spiritual significance and its role for physical and mental detoxification. There are clear documented benefits that if you periodically fast, for example, every 11th day of the month, there is improved autophagy, enhanced metabolic flexibility, and mental clarity. It has parallels from intermittent fasting research findings, and therefore some of the cultural practices which are traditional underscore the holistic approach for health and well-being, and some of the ancient practices predate and support modern dietary trends like intermittent fasting which are coming up. Finally, we are all wanting to live long and we all want to be happy, and therefore we are what we eat, and sattvic diet is one such concept. It's a diet which increases energy, happiness, calmness, and mental clarity with promoting health and longevity. In fact, in the Mahanarayana Upanishad, they say that human beings, if they follow a sattvic principles of life, they should live for 100 to 150 years with spirituality. And the saint diets are fresh, juicy foods which are nutritious and tasty, like fresh fruits and vegetables, sprouted grains, roots and tubers, nuts, cow milk, curd, and honey. And therefore, this is also similar to the modern prudent dietary pattern, improving overall mental well-being and physical well-being and spiritual progress. The Rajasic diet is fueling passion and activity. It can stimulate emotions of jealousy, anger, selfishness. It is recommended for leaders and fighters with potential to excite and boost confidence and intelligence. It's often bitter, tart, spicy, hot, dry, intended to overstimulate body and mind. It has white sugar, radishes, fried food, and stimulating beverages. It may cause increase in intelligence, but also negative emotions and fantasies. And finally, is a tamasic diet contributing to laziness and pessimism. And this is something which may be detrimental to health and spiritual progress. It has stale foods, undercooked foods, overly fried foods, high in fat, meats from tamed animals, onions and mushrooms, and stimulants. And some of them may enhance anger, criminal tendencies, impede spiritual growth, and lower life expectancy. Even our food had a guna-based food classification. For example, Sattvic had the highest micronutrient density, promoting clarity and calmness. Rajasic had moderate micronutrient density, stimulating action and passion. And Tamasic had lowest micronutrient density, stimulating or inducing lethargy and negativity. If you look at nutritional content composition, the fiber content was similar to all types, 14 milligram per kilocalorie. But the fat content was 18% for Sattvic, 42% for Rajasic, 72% for Tamasic. If you look at daily intake, the Sattvic, Rajasic, and Tamasic had their own differences. So when we correlate the overall micronutrients, Sattvic diet had a high correlation, Rajasic had correlation with thiamine, Tamasic was linked to zinc and iron and anxiety, and therefore there is evidence to show, which is published evidence, that Sattvic foods offer superior health benefits, while recommended diet plan focusing reducing Tamasic and Rajasic foods while increasing the Sattvic intake improved well-being. So if you look at nourishing health through Vedic dietary practices, again you can see the Ahara concept is to balance doshas. And also remember that we have Ritucharya, which I have not collated here in my slide, but Ritucharya means seasonal foods, because India is a fasting and feasting country, and eating seasonally and consuming food according to one's doshic constitution, it has significance on mindful eating. And this is all documented and well. What about herbs? And is there science on herbs? Because you are all clinical pharmacologists also, and obviously some of the herbs which are used in Vedic practices had some purported functional food benefits, like ashwagandha for stress relief, turmeric for inflammation, and they were prescribed based on the Prakruti and Vikruti. So if somebody's constitution of Prakruti was Vata, Pitta or Kapha, based on that, whatever is the Vikruti, which is the imbalance, you can have a personalized approach or a precise approach to Vedic medicine. Well, we all know about curcumin. It can improve cognitive function. It can have anti-inflammatory roles. And we are doing more and more, science around this functional food. We collated all the literature of therapeutic role of yoga in type 2 diabetes some time back. We know that the postures, the Surya Namaskars, the Kapalbhatis, the Shuddhi Kriyas, the cleansing, each one of them has a documented impact. And we reviewed this entire literature. So remember that yogic practice will impact behavior, psychology, and physiology, and will have a role in prevention of diseases. And even modern guidelines, including ADA, ESD, or API, now incorporate yoga as a part of the lifestyle approach. So clearly, I mean, I can go on and on speaking, but chapter 2, verse 48 of Bhagavad Gita very clearly said, and I will not go into the Sanskritization of that be steadfast in performance of your duty, O Arjun, abandoning attachment to success and failure, and try to achieve equanimity, which is yoga. And that's exactly what Swami Vivekananda practiced, which was equanimity. And he propagated without fear, without malice, our ancient Indian tradition, values, and religion across the world. His iconic Chicago address is very well known, and we need to recognize that we need to tap and do more and more science and evidence from our ancient Vedic medicine in a modern evidence-based way, so that we can understand better and we can adapt it, because we have all a common goal, which is we want to be free for wellness, and we should move towards wellness, and we need to improve the lifespan, we need to improve longevity. But remember, outcomes related to medicine are not only about health outcomes. Happiness outcomes are as important as health outcomes. And it is important that Vivekananda's teachings, Swami Vivekananda's teachings clearly teach us that we need equanimity, we need the poise, we need happiness and health. And I think we should tap our old ancient Vedic practices and connect them. And probably that is the way we can have a spiritual dimension to health. And some of these practices are very useful as adjuncts in our lifestyle medication. I do not propagate that these systems of medicine will replace modern systems of medicine, but they are perfectly, if they are integrated with the modern system of medicine, we can actually have happier and healthy lives. And we can even see, like, look at prevention, we can look at remission, we can look at modulation of overall health. Thank you so much, Shambho, for calling this entire, spirituality, science, and skill program for holistic healing. And I know that it is on the eve of the Mahakumbh Mela, which is coming up. And we are celebrating the National Youth Day for the Vivekananda Jayanti. So thank you so much. And I must thank Dr. Jyotirmay Paul and the API, the Indian Pharmacology Society, and the Association of Clinical Pharmacologists for having me here. Thank you so much.